Great. Thank you again, everyone, for joining us. We are now live streaming on Facebook. Um, my name is Kate with Cancer Support Community Delaware, and we're here with Beyond Celiac. If you have any questions throughout, please feel free to ask if you're joining us on Facebook. You can type any questions into the comments, and I can ask those for you to the moderators. So at this point, I will pass it over to Valerie Kraft and Deborah Silberg with Beyond Celiac.
Thank you, Kate, and thank you so much for having us. We're really excited to be here and to hopefully answer any questions that you have and sort of demystify everything relating to celiac disease and the gluten-free diet. My name is Valerie Kraft, and I'm the Director of Community Engagement here at Beyond Celiac. So I oversee all of our volunteer programs, all of our signature events, and I personally have celiac disease myself, which is what really, of course, drew me to this role. And I'd like to pass things over to Deb to give a brief introduction of her background.
Hi, I'm Deborah Silberg. I'm an adult gastroenterologist, and I'm the Chief Scientific Officer of Beyond Celiac. And I do not have celiac disease, but I've been very interested in the area as a gastroenterologist. So pass it back to Valerie.
Thanks, Deb. So first, we're going to talk a little bit about what is celiac disease. There is a lot of conflation with other gluten-related disorders and a lot of misunderstanding of the disease in general. So Deb, if you don't mind taking us to the next slide, but celiac disease is an autoimmune disease that's triggered by consuming gluten and results in damage to the small intestine. So when somebody eats gluten that has celiac disease, the immune system sees that gluten as a threat and mounts an attack. Repeated attacks can lead to damaging of the villi, which are those finger-like attachments you see that line your small intestine. So repeat damage over and over again can lead to atrophy, which makes it extremely difficult to absorb any nutrients and can lead to a host of other issues. And celiac disease, although it may be unknown for some folks, is actually fairly common. It's estimated that about 1 in every 133 people have celiac disease, and some recent studies indicate that that may actually be a little bit higher of a prevalence. So how do you know that you have celiac disease? Deb, I'll have you go to the next slide, please. It can be difficult to find that out as well because there can be 250 different signs and symptoms. So unlike an allergic reaction where most folks are aware of things like hives, itching, swelling, because celiac disease is autoimmune, it can have completely different effects that can range from different bodily systems. So there are, of course, sort of the expected GI-related symptoms, things like bloating, gas, abdominal pain, diarrhea, and constipation. But some folks present with no abdominal symptoms and maybe potentially just fatigue or neurological symptoms like brain fog or migraines. And Deb, I'll have you go to the next as well. And so that unfortunately can make celiac disease extremely difficult to diagnose when you're coming in with a subset of symptoms that are maybe not matching what folks might anticipate celiac disease should look like, or if you're coming in with a subset of symptoms that mimic another condition. And so unfortunately, it's estimated that up to 83% of people with celiac disease are undiagnosed or misdiagnosed with other conditions. It took me about 10 years to get my own diagnosis. And on average, we see it takes about 6 to 10 years for someone to correctly get diagnosed with celiac disease, which is something that our organization obviously is working very hard to do, try to shorten that window as best as we can. So Deb, I'll have you go to the next slide. So what do you do about having celiac disease? Well, currently the only treatment for celiac is a strict lifelong adherence to a gluten-free diet. And that's not just taking the bun off the burger, but for those with celiac disease, cross-contamination or even small amounts, think a single crumb of gluten, can mount that autoimmune system attack. It's really important that people with celiac disease follow a strict gluten-free diet to a T because untreated celiac disease can lead to other autoimmune diseases, osteoporosis, thyroid disease, infertility, and certain cancers. So I'll pass things over to Deb to talk a little bit more about the links between celiac and specific types of cancer.
So in celiac disease, compared to the general population, there's thought to be an increase, maybe even 11%. Enteropathy-associated T-cell lymphoma is the one that is most commonly associated with celiac disease. It's actually a very rare cancer and only occurs in 1.9 per 100,000 patients. But the significance here is that it's almost always after the first year of diagnosis,
I'm
and
fine.
the risk factors are men who are advanced age of 60 to 70 years old. They do have more of a genetic susceptibility and oftentimes have a high gluten exposure. The unfortunate thing, it is very, very rare. So I don't want you to think that you're going to get this. It's very rare. But the unfortunate thing is it can be very aggressive and has a very poor prognosis. It, again, is a very rare cancer. The ones that are more common cancers, but not necessarily always associated with celiac disease, are non-Hodgkin's lymphoma, small intestinal adenocarcinoma. And one of the reasons for small intestinal adenocarcinomas is anytime you have a lot of inflammation in a particular organ, it can lead to malignancies. And that's one of the issues with celiac disease, is that when it's not under control, especially, you're getting a lot of inflammation. There's also some hepatobiliary, which are liver and bile duct malignancies. And there can be some pancreatic cancers associated. But again, for those, there's only a slight increase in celiac disease from the general population. Were you
Thank you.
going to take this, Valerie?
Yep, I can take
Okay.
this from here. So let's talk a little bit about some of the different gluten-related disorders and how they differ from celiac disease. So the reaction is the key difference. With celiac, again, it's an autoimmune reaction, unlike an allergy, and there really actually isn't such thing as a gluten allergy. There is a wheat allergy or there is non-celiac gluten sensitivity. A wheat allergy is where you would see that classic allergic reaction. But there are people who just feel better eating gluten-free that don't have a wheat allergy or celiac, and that's referred to as non-celiac gluten sensitivity. So for people who are non-celiac gluten sensitive, they may not have to follow as strict of cross-contamination rules as people with celiac disease or wheat allergy have to do, because they may be able to tolerate small amounts of gluten without feeling sick. And because small amounts of gluten won't damage them internally the way it will with celiac disease, it's not so much of an issue. So Deb, I'll have you move on to the next slide. So again, with non-celiac gluten sensitivity, the exact cause is unknown. It's the same reason why certain people feel better just not eating certain foods. But again, the key difference here is that it does not involve damage to the small intestine the way it does for celiac disease. There currently is not a definitive test. The test that definitively does diagnose for celiac disease cannot and does not diagnose non-celiac gluten sensitivity, but there can be some overlap in symptoms. So let's talk a little bit more about what exactly is the gluten-free diet, what is gluten and what is gluten-free. Gluten is a protein that's found in wheat, barley, rye, and derivatives of those grains. So that also includes things like malt or brewer's yeast. So following a gluten-free diet means excluding any foods that contain these ingredients. And again, foods that may also be cross-contaminated with gluten-containing ingredients. And gluten can hide in a lot of weird places. There's sort of the obvious examples that come to mind, your breads, your pastas, but it can also be in things like gravies, soups, sauces. Wheat is often used as a thickener. Oats can typically be cross-contaminated with wheat because they're processed with gluten-containing grains like barley. Sometimes it can be present in candy, in things like vinegar, cereals, mixes, chips, seasonings. So it's always important to sort of not rely on what feels like that would naturally be gluten-free and take a look at the ingredient label. I know one of the things that surprised me the most when I got diagnosed were things like licorice or pickles potentially having gluten in them. So what is cross-contact or cross-contamination, as you may hear it referred to? So that's when something that's gluten-free is exposed to a surface that either contains gluten or has touched something that contains gluten. So some examples include using the same toaster for a gluten-free and gluten-containing item. If you have a slot toaster, you put a regular bagel in, take it out, now put a gluten-free bagel in. That gluten-free bagel is considered cross-contaminated and would not be safe for somebody with celiac to eat. So as you might imagine, a lot of the work with celiac disease is not just making sure that your ingredients are gluten-free, but making sure that the way you're preparing your food or the way that your food is being prepared for you in a restaurant is also being done in a way that's celiac safe. So again, things like same condiments, if you're making yourself a peanut butter and jelly and put your knife in, get it on your bread, put your knife back in, you've contaminated that jar of peanut butter with gluten. Same thing if you're using a cutting board, cutting a, loaf of gluten-free bread on a cutting board you use to cut a regular loaf of bread. So again, for people with celiac disease, prevention of cross-contamination is key, but for people with non-celiac gluten sensitivity, they may not need to be as stringent. So what can you eat? The answer is actually quite a lot. All of your fruits and vegetables, dairy, butter, yogurt, meat, chicken, fish, pork, beef, eggs, all sorts of things, grains, again, corn, rice, buckwheat, don't let the name scare you off, tapioca, potato flour, almond flour, coconut flour. It really does include most items, even though off the bat it feels like wheat or gluten is really present in everything. So how do you know when something is or isn't gluten-free? So here in the USA, ingredient labels are available on almost all commercial food products. And right now, if you imagine a food label in your mind, you can probably think of the bold font where it says contains XYZ. Maybe it says milk or eggs or wheat. So because wheat is one of the top 8 allergens, here in the US, it is required for a manufacturer to actively call out when wheat is present. So if there's wheat in a product, it will say contains wheat. However, if a product has something like barley or malt in it, the manufacturer does not have to say contains gluten. So a lot of labeling reading for people that need to be gluten-free is dependent on 2 different factors. One, is there a gluten-free label on the product? And is that a gluten-free labeled or a certified label? And 2, does the ingredient list contain anything that is a derivative or is gluten? So I know it can seem overwhelming at first, but we've got some handy tips here on this next slide about how to determine where sort of in the range of safety a product is. So the number one safest option is, of course, something that is certified gluten-free. And what that means is that item has been tested and proven to contain less than 20 parts per million of gluten. And for some certification programs, that is even lower at 10 or 5. Now, just because something is certified gluten-free and something isn't, doesn't mean that that product is unsafe. A lot of base ingredients, so again, your fruits, your vegetables, your meats, those are not necessarily going to be certified gluten-free because they're not going to be marked as anything. They're just a base ingredient. But there will be other items that will be potentially labeled gluten-free. And that means that it must contain, again, that less than 20 parts per million, but has not necessarily been tested and proven with an outside facility. Then sometimes you'll see products that are labeled gluten-free or certified gluten-free, but they'll say made in a facility that contains wheat. That is a statement that a manufacturer is voluntarily saying. They don't have to tell you, but sometimes that may mean in a giant football field size factory, there's one line that uses wheat, and they're letting you know that. So just because it's present in the same facility doesn't automatically mean it isn't safe. Now, over here on the right side is where it starts getting a little bit more into that gray area. Something is unlabeled but does not contain gluten. And again, this may be things like a frozen veggie mix, where it's very unlikely that that's going to be cross-contaminated in any way, but it's not labeled gluten-free. It just doesn't contain any gluten-containing ingredients. Moving on down, of course, when we see something that is also unlabeled, but then also says may contain wheat or was made in a facility, definitely a place to exercise more caution. And then obviously number 6, if anything contains wheat or a gluten-containing ingredient, that is a definite no-go. So one of the issues with the gluten-free diet is it can be more costly. It's worth noting that the cost of the gluten-free diet has actually come down a fair amount in the past decade or so, but it still is more expensive to buy a gluten-free loaf of bread than it is to buy a normal loaf of bread. So some of our best tips for maintaining gluten-free on a budget is sticking to naturally gluten-free foods. Again, building meals off of fruits, vegetables, meats, cheeses. Those tend to be more affordable and not sort of have that gluten-free upcharge. Rewards programs at grocery stores are also very helpful. Same with the weekly flyers, in-season fruits and vegetables, joining your local Buy Nothing Facebook group, and sometimes purchasing a membership at wholesale groceries like Costco, Sam's, or BJ's can be worth it in the long run. And lastly, buying generic brand products, not name brand, can also help save. So lastly, I'll pass things back to Deb here just to chat a little bit more about getting involved with some of the research we're doing.
So one of the things that our organization, Beyond Celiac, does is collect really insights from patients. And we ask patients, we do surveys and have a registry to get information about the patient experience. And one of the things we do when we're asking about surveys is to find out about patients' symptoms and what their journey has been in terms of celiac disease. Right now, it's all adults, though we're talking about trying to do something for parents and adolescents as well. But in general, what we do is collect this information, we analyze it, and we've actually presented a lot of our data at big, mostly gastroenterology meetings, but we also would like to do this to primary care as well. But to get people to really understand what celiac disease is and the kind of symptoms and signs and patient experience. So if you're interested, there's a sign up, and we also have a place you can ask questions. I think that's the end of our presentation today. I did want to just say something, because this becomes kind of an issue for people when they're trying to get diagnosed. So a lot of people suspect they might have either a gluten sensitivity or celiac disease, and they go on a gluten-free diet and then see their doctor. That becomes a little bit problematic for the physician to then diagnose celiac disease or to differentiate it from something else. Now, clearly, if it's making you feel better, we don't want you not to do it. But if you want to get a diagnosis, it's a lot easier and more straightforward if you're on gluten when you come to a physician. And the reason is the basic test that we do is an antibody test. That's the first line test. And it's an antibody to something called transglutaminase. To have this antibody present, you actually need to have some gluten exposure, because it's an antibody that's reacting to the immune response that you have to gluten. So if you're on a gluten-free diet and you get tested and the antibody isn't showing, we don't know at that point whether or not you really have celiac disease. So what I would suggest is try to first go to a doctor and get the antibody test. The other thing is sometimes you get the antibody test and people say, oh, I must have celiac disease. They go on a gluten-free diet, then they go to the gastroenterologist, who then wants to do the second line test, which is an endoscopy and biopsy of the small intestine. Again, if you're on a gluten-free diet, your intestine may go back to kind of more of a normal state. So then we can't diagnose either when that happens. So there are other things we can do to diagnose, but these are kind of the pitfalls of just going on a gluten-free diet on your own without discussing this with a physician or a dietitian or a nutritionist. So just wanted to make that point. The other thing is, and we did talk about this as an autoimmune disease, it's actually based on a genetic, what we call genetic predisposition. So we know that there are two what are called HLA types. So HLA is a gene type that is how you respond to factors that can cause an immune response. And there are two that are very common in celiac disease. However, 30% of the entire population has those two genes, but only, as we said, 1% of the population has celiac disease. So that means that there are other factors, not just the genes, that make people react and have celiac disease. So just because, if you do 23andMe or you do Ancestry.com and they tell you you have these HLA types, it doesn't mean that you have celiac disease or you're going to get celiac disease. It just means that you're predisposed to the possibility of getting celiac disease. Okay, so I think we can open up to questions at this point.